Hi, I'm Dr. Anthony Mazzola, and I am one of the interventional pain management and rehabilitation medicine physicians at the Mount Sinai Doctors Medical Group. I'd like to take a few minutes to discuss what you can do to manage your low back pain. Low back pain is a common disorder that many of us will experience and may struggle with throughout our lives. Fortunately, most episodes are self-limiting and will improve, allowing you to gradually return to your regular activities. Symptoms can be limited to the low back itself and/or include radiating pain down to the glutes and lower extremities. Burning, tingling, and/or numbness shooting down the leg is known as sciatica, which is often caused by pressure on the spinal nerves from a bulging or herniated disc. So what can you do if you develop low back pain? First, and perhaps most importantly, is try and stay active when possible. Often, movement and progressive exercise is beneficial for musculoskeletal pain. Activity modifications can also be helpful. If your work requires long periods of sitting, try and change or shift positions throughout the day and utilize an ergonomic workstation or stand when possible. Short breaks of walking, even a few minutes every hour, can be beneficial. If your work requires heavy lifting or strenuous physical activity, it may be necessary to request temporary light duty, and when progressively returning to work, be sure to lift and bend, activating your core, legs, and glutes to avoid excessive strain on forces on the spine itself. If your pain is particularly excessive at night, try sleeping on your back with a pillow elevating your knees to decompress and relax the lower spine. If you prefer sleeping on your side, try utilizing a body pillow or a pillow between your knees to ensure proper alignment of your spine throughout the night. Fortunately, the majority of back pain will improve within weeks. However, if pain is not improving or if your function remains limited, it is best to schedule a clinical appointment to further assess the source of your pain. A thorough physical examination and appropriate imaging studies can help determine your diagnosis. The primary goal of treatment will be to improve your pain and function, getting you back to your life and daily activities. Physical therapy can improve movement, strengthen and stabilize the spine, and overall reduce pain symptoms and help limit these episodes from reoccurring. The addition of non-opiate prescription medications can decrease inflammation and manage symptoms. If conservative treatments are not successful, targeted interventional procedures utilizing X-ray or ultrasound guidance may be recommended. These can include trigger point injections, joint injections, nerve blocks, or epidural steroid injections. In summary, if you are suffering from low back pain that interferes with your day-to-day activities, please be sure to schedule a visit. Thank you so much for listening, and if you need us, we're here.